रहे थे हाइपोथर्मिया माइल्ड मॉडरेट सीवियर हो गया था। अब रेगुलेशन बाय हाइपोथैलेमस टेम्परेचर को रेगुलेशन करता है हाइपोथैलेमस एंटीरियर पार्ट और पोस्टीरियर पार्ट। एंटीरियर पार्ट क्या करता है, हीट लॉस बाय स्वेटिंग, पोस्टीरियर पार्ट हीट प्रोडक्शन बाय सिवरिंग, बट इट बर्थ hypothalamus is underdeveloped male regulation of the temperature. Prevention measure for hypothermia: brown adipose tissue, brown fat, fix posture, less body explore to environment, decrease surface area, metabolism highest it birth, excessive breastfeeding 0 से 6 month and heat generation, dry the body of newborn, method of the heat loss reduction, indirect or coaddiction method. Reduction: indirect heat loss without any contact heat is emitted in the form of infrared radiation from the body surface to the surrounding environment. 60% heat loss reduction. Warmer conduction method: heat loss by direct contact, example KMC यानी कि कंगारू मदर केयर, स्किन टू स्किन कॉन्टैक्ट, एक्सेसिव ब्रेस्ट फीडिंग, अर्ली डिस्चार्ज, डिक्रीज हॉस्पिटल स्टे, फॉलो अप, डेवलप इमोशन, बाउंडिंग मेजर हीट लॉस ऑर्गन इन न्यूबॉर्न 25% ऑफ हेड। फिर है कन्वर्जन बाय एयर, एग्जाम्पल incubator heat fan, evaporation by vapor, sweating, breathing, wet clothing, baby cover the blanket to prevent evaporation of heat loss. Sign and symptom of hypothermia: vasoconstriction due to decrease blood body temperature, or aerocyanosis, peripheral cyanosis, central cyanosis. Cyanosis causes acidosis, bluish discoloration, can seen it mucous membrane of the oral and lip. Bradycardia, decrease so beat per minute, Down syndrome, lethargy, poor feeding causes decreased metabolism and Watson. Hypothermia does breathe first 24 hours of life. Premature main cause neonatal morbidity rate and premature hypothermia. फिर है ब्लड प्रेशर, बर्थ के टाइम 80 से 50 होता है, सिस्टोलिक और डायस्टोलिक होता है 50 mmHg, और 1 ईयर पे 90 से 50 हो जाता है, और 25 साल पे 120 से 80, और 60 साल के बाद 160 से 90 हो जाता है। धीरे धीरे प्रेशर बढ़ता है। पेरिफेरल रजिस्टेज, लेस इलास्टिसिटी ऑफ द ब्लड वैक्यूल्स, ब्लड कफ कवर बॉडी आर्म्स 2 से 3। In newborn, no change BP in upper and lower extremities, gap with 15 to 20 mmHg of the inhaled client. फिर है केयर ऑफ न्यूबॉर्न, इनिशियल केयर ऑफ द न्यूबॉर्न, असेसमेंट करना, असिस अबगार स्कोर, क्राई टू इन एलिमेंट ऑफ अबगार स्कोर, मॉनिटर फॉर नेजल फेरिंग, गंटिंग, retractions and abdominal respiration such as a swan respiratory pattern, rise and fall it the chest and abdominal do not occur together. Assist for cyanosis, obtain vital sign or observe the newborn for sign of hypothermia or hyperthermia. Assist for gauge anomalies, intravenous suction the mouth first and then the nurse dry the newborn and stimulate caring by the rubbing of the newborn in warm blanket. Keep the newborn with the mother to facilitate bonding. Place the newborn in mother breast. If breastfeeding is placed on the side of the facilitate the drainage of mucus. Place the newborn in radiant warmer if required. Abgar scoring by Virginian Abgar 1952. The newborn Abgar score is associated and recorded it 1 minute and it 5 minutes after birth. तो इंडिकेशन क्या होगा? हार्ट रेट, रेस्पायरेशन, मसल टोन और रिफ्लेक्स इरिटेबिलिटी। तो इंडिकेशन क्या होगा? 0 पॉइंट क्या होगा? अपसेंट होना तो 0 पॉइंट देंगे। 1 पॉइंट 100 से ज़्यादा होगा बर्थ पर मिनट और 100 से कम होगी तो 1 पॉइंट देंगे। 100 से ज़्यादा होगी तो 2 पॉइंट देंगे। रिस्पायरेशन अपसेंट हो तो 0 और स्लो और इरेगुलर वीक क्राई हो तो 1 देंगे और गुड इरेगुलर और वैग्रसली क्राई हो तो 2 देंगे। मसल टोन या फेलिस्ट लिम्फ हो तो 0 देंगे और मिनिमम फैक्शन और एक्सट्रीमिटीज़ हो तो 1 देंगे और गुड फैक्शन और एक्टिव मोशन हो तो 2 देंगे। रिफ्लेक्स इरिटेबिलिटी में नो रिस्पॉन्स हो तो 0 और मिनिमम रिस्पॉन्स या ग्रेमस टू सक्शन हो तो 1 और रिस्पॉन्स प्रोमेटली विथ ए क्राई और एक्टिव मूवमेंट तो 2। स्किन कलर में पाल्मर और साइनोसिस होगा तो 0 और बॉडी स्किन नॉर्मल पिंक या एक्सट्रीमिटीज़ ब्लू हो तो 1 और बॉडी एंड एक्सट्रीमिटीज़ स्किन आर नॉर्मल पिंक कलर हो तो 2। फिर है इंटरवेंशन। नो इंटरवेंशन इज़ रिक्वायर्ड। देखो फिर है हम इसमें अबगार स्क्वायर में कैसे करेंगे? 7 से 10 आ रहा है तो नो इंटरवेंशन रिक्वायर्ड। 4 से 6 आ रहा है तो जेनिटल स्टिमुलाई और रब और इनफैक्ट बैक और टू एडमिनिस्ट्रेशन। रब जो पीछे की रब होती है, मतलब रब करेंगे बैक को और O2 देंगे। और 0 से 3 आ रहा है तो क्या करेंगे? रिससिटेशन करना पड़ेगा, इन्फेंट को रिक्वायर है। फिर भी क्या है? इनिशियल फिजिकल एग्जामिनेशन, वाइटल साइन, हार्ट रेट रिजल्टिंग 120 to 160 पर मिनट एपाइकल। फिर क्या है? अस्क्यूलेटेड इट द फोर्थ इंटरकोस्टल स्पेस फॉर 1 minute, 1 full minute to detect abnormality. Respiration 30 to 60 beats per minute, 40 average. Assess heart rate and respiratory rate first whole the newborn is resisting or sleeping. Auxiliary temperature 97.5 Fahrenheit to 99.5 Fahrenheit, 36.5 Celsius to 37.4 Celsius. Blood pressure 80 to 50 mmHg. बॉडी मेजरमेंट लेंथ कितनी होती है? 45 to 55 सेंटीमीटर, 18 से 22 इंच। वेट होता है 25 ग्राम से 400 ग्राम। हेड सरकम 33 से 35 सेंटीमीटर, इंच में 13.22 ये 14 इंच। और चेस्ट सरकम होता है 30 to 33 सेंटीमीटर। हेड क्या होता है? हेड शुड बी 1/4 और 25% ऑफ द बॉडी लेंथ। हेड सरकम्स 37 to 35 सेंटीमीटर। बोन ऑफ द स्कल आर नॉट फाउंड। स्यूचर होते हैं उसके अंदर, कनेक्टिव टिश्यू बिटवीन द सूचर बोन एंड मैलिपिला fontanelles are unsaturated membrane tissue at the junction of the suture. Cardinomyocynosis, perimetrial function of the suture, modeling in asymmetrical of the head, disappear in the abdominal about 32 hours. Capsule Sustedum is edema of the soft tissue cover bone substance with a few days. फिर क्या है? ये डायग्राम देखो, इसको बोलते हैं स्कैल्प एडिमा, पेरिटोनम, स्कल बोन, सैजाइटल सूचर। फिर है सेपेलो हेमेटोमा, इट इज स्वेलिंग caused by bleeding into the area between bone and it is observed within 6 weeks with no treatment. 6 week में अपना आप सही हो जाएगा, ट्रीटमेंट की ज़रूरत नहीं है। देखो सिग्नोइड स्यूचर, स्कल्प, पेरिटोनियम, ब्लड और स्कल बोन। eyes stays gray, light color, dark blue or brown gray, dark skin, symmetrical and clean, pupils equal, round, react to light and by accumulation, eyelid upon edematous as a result of pressure during the birth process. Eyes symmetrical, top of pinna on or away, line down from outer synthesis of eye, low set ear associated with Down syndrome, mouth pink, moist, gossamer, soft and head petals intact, away to swallow, rooting and gay reflex present. Look for the presence of oral thrust, condysis, alveolis, which are white patches area on the tunica. फिर क्या है, नेक वाला है. फिर क्या है, नेक short and thick, head hold in midline, good range of motion and ability to fix and extend. फिर है chest, circular approaches because anterior, posterior and lateral diameter are about equal, 30 to 33 centimeter or 12 to 30.2 inches at birth. Nipples prominent and endometrious, milk secretion common, breast tissue present. Skin क्या होती है, pinkish red to pinkish brown और pinkish yellow. Acrocyanosis, pink tongue but blue hand and feet is normal in the first few hours after birth. Melena, white papules on the face, more frequently seen on bridge of the nose and chin. फिर क्या है, फिर है वेरिनस सिरोसा, a cheesy white substance can be found on anterior body. Langulo, fine hair mid to be seen especially on the back. Cyanosis, blue discoloration with hypothermia, infection and hypoglycemia. Ashes of the skin tongue over the abdominal to determine hydration status. Hair liquid sign, deep pink or red color develops over one side of the newborn body while the other side remains palm or of normal color. It indicates suturing of the blood that occurring with a cardiac problem or may indicate sepsis. फिर है बर्थमार्क में टेलिंगोसिस, नेवी और शॉक बाइट और एंगल किसेस. Plant pink or red, plant dilate capillaries on way, eyelids, nose, lower occiput bone and nip of further neck, more notable during crying period, may disappear by age 2 years. About 50% of adult stick have stroke bites. Monogonian spot, bluish black pigmentation on lumbar distal area and buttocks. disappear कब होता है, 1 से 2 year of life. Abdominal umbilical cord बराबर 2 arteries and 1 vein. Small thin cord may be associated with poor fetal growth. Cord should be clamped for at least the first 24 hours after birth. Clamp can be removed with the cord is direct or no longer bleeding. Not any bleeding or drainage from the cord. If symptoms of the cord infection or paralysis such as moistness, oozing, discharge and readiness base occurring, antibiotic treatment is prescribed. फिर है gestational system monitor code for Mannonium staining, abdominal distension, monitor bowel sound which should be occurring within 1-2 hours after birth. Anus. Ensure that the anal opening is patent. First stool meconium बोलते हैं. Should passes within 24 hours. Genitals. फीमेल में तो labia are endometrious, clitoris in enlarged, pseudo menstruation caused from the withdrawal of the maternal hormone estrogen is possible. Blood linkage mucus first violating should occurring within the 24 hours. Male produce foreskin cover the glass penis. फिर क्या है? Scrotum is endometrious, verify mattress, a tip of the penis. First voiding should occurring in the 24 hours. फिर है body system assessment. Cardiovascular system, measuring the apical heart rate full 1 minute. Listen for murmurs. Assess oxygen saturation by AU pulse oximeter. Second है respiratory system, suction the airway. Observe for respiratory distress and hypothermia, nasal foaming, grunting, cyanosis, bradycardia and period of apnea lasting longer than 15 seconds. Abdominal administration O2 by hold if necessary. Third है hepatic system. Normal or physiological jaundice after 24 hours in full term newborn and after the first 28 hours in preterm newborn. Physiological jaundice peak 5 days of the life. Indirect bilirubin 6 to 7 mg dl. Pathological jaundice within 24 hours and increase 15 mgl dl. Feed early to keep the bilirubin level low. Risk for hemotic disorder. Cognition factor dependent on vitamin K, which is not synthesized util intestinal bacteria and present. Administration IM injection of vitamin K 0.5 to 1 mg to present hemorrhagic disorder is lateral aspect to middle third of the vascular-lataris muscle. Renal system, normal urine output 60 ml in first 24 hours. A weight loss of 25% to 50% during the first week of the life occurring as a result of the voiding and limited intake. Birth weight should be regained by 10 to 14 days after birth. फिर क्या है? मॉनिटर इनटेक एंड आउटपुट. वेट डायपर 1 gram of diaper weight equal 1 ml of urine. Assess for sign of the dehydration, dry mucosa membrane, skin eyeballs, poor skin texture and skin spontaneous. Immunity system, newborn receive passive immunity from placenta during fetal life. Immunoglobulin G, standard prescription hand washing, administration eye medication within 1 hour after birth to prevent ophthalmos ophthalmia newtamus, erythromycin 0.5% or tetracycline 1%. Ophthalmos drops are used to prevent against naria, gonorrhea and calamia tendromitis. Provide cold care, assist code for odor, swelling and discharge. The newborn is washing by a sponge bath until the cord fill after within 2 weeks. फिर क्या है, metabolic system and gastrointestinal system. Newborn are able to digest simple carbohydrate but are unable to digest fat because of the lack of the lipids. Small stomach capacity about 90 ml with rapid intestinal persistency. Bowel emptying time in 2.5 to 3 hours. Breastfeeding can begin immediately after birth for every 2 to 3 hours. Observe feeding relax such as a sucking and swallowing. Birth the newborn during and after feeding. Observe for normal stool and the passage of meconium stool, which is greenish black with a thick sticky dry-like consistence. Usually passes within first 24 hours of life. Slightly yellow stool are usually noted in breastfed newborn. Neurological system. Newborn head size is proportionally larger than that of the adult. Frontals are open to allow for brain growth. Assess for in abdominal head size and bulging or dependent anterior frontals. फिर क्या, assess the newborn movement and symptomatic posture and abdominal movement. Test newborn reflex. Assess for lethargy. Assess pitch of the cry. Thermal regulation system. Prevent cold stress. Newborn do not sweat to produce heat. Prevent heat loss by keeping the newborn by dry and will vapors with a blanket. Prevent heat loss resulting from radiation by keeping the newborn away from cold objects and outside walls. Prevent heat loss resulting from conducting by performing all treatment on warm produced surface. फिर है cardiac system. Heat anatomy and physiology. Located in center of the chest, about the size of the chest. Fist heart rate varies with the age of the child from 60 to 160 beat per minute. A child heart pump as hard as adult heart. Chamber of the heart. 4 chambers, right and left, or atria and right and left ventricles. Right atrium. Right atrium collect deoxygenated blood from the entry body. Why vena cava except from lungs. Right ventricles pumps deoxygenated blood to the lungs. Why the pulmonary artery. Left atrium collect deoxygenated blood from the capillary beds of the lungs through the pulmonary vein, or left ventricles pump oxygenated blood through the aorta to systematic circulation. Heart wall. 4 wall prevent blood from regurgitation. 2 are the Anteroventricular wall, AV wall, and connect the atria and ventriculars. Tricuspid 3 lips, connected right atria to right ventricles. Bicuspid 2 lips, connected left atria to left ventricle, also known as mitral wall. Aortic and pulmonary wall similar, of half moon shape. Pulmonary connected right ventricle and pulmonary artery. Aortic connected left ventricles and ascending aorta. Heart vessels, vena cava, carrier blood to right atrium. Superior vena cava, carrier deoxygenated blood from the heart and arm. And left body arm and upper body lesion away to the heart. Inferior vena cava carry deoxygenated blood from leg, abdominal cavity and lower part of the body to right atrium, lies below the heart. Pulmonary artery carry deoxygenated blood from right ventricles to lungs. Pulmonary vein carrier deoxygenated blood from right ventricular to lungs. Pulmonary vein carry oxygenated blood from capillary beds of the lungs to the left atrium. Aorta, large vessels that carry deoxygenated blood from the left ventricles to the rest of the body. Normal blood flow. Blood is pumped out of the heart. Blood carry oxygen via hemoglobin to the tissue. Oxygen necessary for cell function. Tissue perfusion is maintained by suffering and cardiac आउटपुट. ये अपना न्यूनेट एंड वाइटल साइन कंप्लीट हुआ. अगले चैप्टर में हम फिटल सर्कुलेशन पढ़ेंगे. थैंक यू सो मच.